Hi guys, thank you for coming back to our EpiCentre Seminar Series. I really apologize for those who attended last week, but we couldn't deliver it in due to the technical reason. So today the presenter is Dr. Peter Moono. He is a veterinarian and with his research interest in epidemiology. He did his master course with EpiCentre and he moved to Australia to obtain a PhD degree. After completing PhD, he joined Vet South as an epidemiologist, and now he's back to Massey Uni, working as a teaching technician in the vet school. Today, his presentation is a snapshot of his PhD project, which was about investigating the epidemiology of determinants of Clostridium difficile infection in pigs and establishing the transmission pathways in the human population. Hey, Peter, it's all yours.
Hi, thank you so much. Sorry for last week's technical glitch, as John has said. I'll walk you through my presentation from now. This work was supervised by Professor Thomas Riley and Professor David Hampson from the University of Western Australia and Murdoch University. Okay, I'll walk you through my talk. I'll talk about the basics about what we know about Clostridium difficile. Then I'll talk about the epidemiology from the hospital settings and also the infections in the community. Then I'll talk about what we know of the epidemiology in the livestock. Then I'll walk you through 3 short projects from my PhD. Then I'll talk about the implications and the conclusions. So Clostridium difficile is the most common nosocomial infections in the healthcare settings, and it's also emerging as a problem in the livestock industry. It's a gram-positive spore-forming bacillus. So the pathogenicity is mediated through 2 major toxins. Toxin A, which is roughly 308 kDa, and toxin B, which is roughly 270 kDa. Both toxins target the cytoskeleton and the tight junctions of cells, so leading to cell rounding and cell death. Some strains produce a third toxin called a binary toxin. This is similar to that which is produced by Clostridium perfringens, for those people that are aware about Clostridium perfringens. So the strains that do not produce toxins, they lack this pathogenicity locus, although studies have shown that these strains can acquire the pathogenicity locus horizontally. So the infection is usually acquired through the fecal-oral route, so it's quite widely spread in the environment and also affects quite a lot of hosts from sea mammals to land mammals. So understanding the epidemiology of this pathogen together with using high resolution diagnostic tools are cardinal in controlling the infection in both the human settings and the livestock industry. So what do we know about Clostridium difficile in the hospital settings? This pathogen it started being observation started around the 70s when broad spectrum antibiotics were developed, such as clindamycin. So mostly the observation was people taking antibiotics starting developing diarrhea, particularly for clindamycin. This was a huge thing for North America and Europe. So it's become the pathogen was identified in 1978 that it was Clostridium difficile. This word comes from the French word meaning difficult to culture or identify. So it accounts for over half 500,000 infections in the United States per year, and it accounts for over 30,000 deaths in the United States alone. So up to 17% of the elderly patients admitted to the hospitals are colonized. So for patients who are primarily receiving antibiotics, up to 33% experience recurrence. That's quite high. So the map on the right side, if you can see, the amber part represents the sporadic outbreaks that were associated with ribotype 027. And this was the fluoroquinolone resistant strain, which also was found to produce more toxins and also produce more spores. These spores are quite resistant to a lot of disinfectants, and they're also resistant to heat, actually up to 70%, up to 70 degrees, they would survive that, which will put, yeah, about that much. Sorry. So the clinical presentation is people experience obvious asymptomatic carriage to severe diarrhea, to those that may experience the worst outcome of this condition would experience pseudomembranous colitis. So from the picture which is coming up on the right side, you can see the severe form that to me suggests pseudomembranous colitis, and on the left side, that's a normal colon. So the ones experiencing the severe form, some of them might experience gut perforation, which might lead to death. So what are the risk factors? It has been shown that people who are 64 and above are likely to experience this infection. So previous exposure to antibiotics is one of the risk factors, because what we know about antibiotics is that they also degrade the normal gut flora. And this has been proved by other studies, high resolution studies that use bioinformatics. So comorbidities is one of the risk factors. Chemotherapy, it also, my understanding is people taking chemotherapy have their immunity compromised because of the suppression of the treatment. Prolonged stay in the healthcare system also is a risk factor because of the spores that these people may get in contact with. So female has been found as a risk factor, but obviously this is because maybe females are more likely to look after kids who are a high risk factor for community-associated infections. Then also a study coming out from the UK has shown that females were 40% likely to seek medical care resulting in antibiotic treatment. So the effect of antimicrobials on the gut normal flora. In the left panel, as you can see, when antibiotics have not been used, the normal flora, gut flora does not allow C. difficile to proliferate. So once antibiotics has been taken, then, sorry for that, I have to move it backwards. Once antibiotics have been taken, then disruption of the normal flora happens and C. difficile takes foothold. Then once antibiotics are taken away, then the gut normal flora starts regenerating and the C. difficile risk starts going down. And regeneration of the normal flora takes for weeks to years. So a study coming out from the United States, the CDC, have shown that prudent use of antibiotics in hospital settings does actually reduce the infections, but also I would imagine probably improved hospital improved infection controls in the hospital could also have played a role in this one. So at the same time, when C. difficile was raging, the outbreaks around the year 2000, we started also seeing infections in the lower risk group, which are younger people, less than 64 years old. So initially, the community associated accounted for between 2 to 5%. That was the incidence. It was just bounding around that. But this is the report coming out from the USA showing that it has gone up to 32%. And this is corroborated with Turner and colleagues who have shown that actually the incidence is actually still going up, it's still rising. And in the same time frame, we have seen this in Australia, three-fold increase for community-associated infections. So this is a widespread across many Western countries where the diagnostics have been instituted or the surveillance is better compared elsewhere. So is C. difficile a zoonotic infection? Pretty much it's difficult to say at this stage, but maybe as the story goes on, I'll show our findings. So Professor Riley, because he's been working in this area for a long time, he believed the risks of infections lied beyond the hospital bed. So there was this collaboration that came up with the medical school and the vet school in Western Australia to demonstrate a One Health approach would probably be the best way to control some of these pathogens that have got a complex transmission pathways. So for that. So why did we choose to investigate C. difficile in pigs? Generally speaking, pigs are known to amplify a lot of pathogens. C. difficile obviously wouldn't be any different, but the livestock that exists or farmed in Perth, most of it is pigs are the major population of livestock that we have because of the nature of the environment. So as you can see, potential pathways for infection in the or transmission pathways would be food, which will be vegetables, and also through meat. And there's also a possibility of wildlife playing a role, but for this work, I'll only focus on the meat pathway, biosolids going into vegetables, and also potentially the environmental contribution through lawns. So, like I said before, this is the scenario for Perth. Perth is a small city which is actually growing. Most of the population live here, but most of the time they work up here where the mines are. So the suburbs, if you went to Perth, you'd find everything looks as green as New Zealand. Obviously, because of access to manure and vegetable gardens, both commercial and home gardens, they have got access to manure from the piggeries. So the reports about C. difficile also emerged around the year 2000. In the North America and Europe, there have been reports which have shown that C. difficile actually is associated with diarrhea in neonatal piglets. So the prevalence is quite high actually, but in Australia we have seen the prevalence in piglets ranging between 20 to 70%. So outbreaks are common in 1 to 7 days old piglets with mortality up to 16%. Piglets can be up to 15% underweight, which would lead to delayed weaning. That also impacts on the economics for the enterprises. So as you can see in Europe, some people have shown that neonatal diarrhea accounts for up to 134 euros per year per sow. That can be huge if you've got 10,000 pig that have got sows that many. So what are the risk factors for C. difficile in pigs? Age, as I said before, then the contaminated environments. At this stage, we don't know the infectious dose for this pathogen. So what we know is colostrum, good quality colostrum could potentially reduce the infections. But as we know, studies have shown that goats actually have poor colostrum. So probably not surprising why this infection takes hold so quickly. And also use of antimicrobials in the livestock industry elsewhere, except for the few years back, it's been widely known that growth promoting antibiotics have been used in livestock. So we would expect that use of antimicrobials could probably increase the spread of this pathogen. So the clinical presentation in pigs, mostly it will be similar to what is presented in the human settings, moderate enteritis to severe mesocolon edema. As you can see in panel A, this is the spiral colon of a piglet that is not infected. On the right side, this is a spiral colon of the infected piglet. So as you can see, sorry, Emel Val, did you want me to help to answer a question? Okay, sorry. Yeah.
No, sorry, it just came on my way and I clicked by mistake, sorry.
Okay, no, that's all right, perfect. So most of this edema is potentially as a result of protein losing enteropathy, which also would explain why there's ascites and hydrothorax in severe cases. So what's the diagnostics used in the laboratories? PCR is quite a common tool that we have used for surveillance. So immunoassays, histopathology in combination of the immunoassays have been widely used. But what we found is most of the human diagnostic tools have not been validated for animal samples and kind of perform poorly. So treatment, antimicrobials are effective for a vegetative state, but not for spores. So that's kind of difficult to use. Immunoprophylaxis, no, we don't have any validated vaccine or marketed at the moment. So disinfectants such as sodium hypochlorite, they kind of work very well in the environments where there are less organic substances, but much more difficult in the livestock settings. Probiotics and fecal replacement therapy have shown more promising, but nothing has been done for livestock so far. So as you can see, these are genetic overlaps of strains by ribotyping techniques. So ribotype 078 and 027 are the most important in North America and Europe. And in Australia, we have seen ribotype 014 to account for 25%. So the ribotype 078 and 027 have not been isolated in Australian piggeries. So there's this general overlap of strains, but ribotyping is not high resolution typing tool. So we can't call this as zoonotic at this level because of the tools they are not high resolution. So the first study that we did, we got a baseline study, just roughly 9 liters in the 1 to 10 days old piglets. So at the same time, we also chose 4 liters, and from those liters, we had 20 piglets, which we sampled on 5 different time points of their life. So we also sampled the environment just to make sure what was in their piglets was probably how was also still transmitted in the environment. So this is the culture and typing methods. I'll not really talk too much through this. PCR toxin profiling and ribotyping was mostly targets the 16S to 23 intergenic spacer, for those who may understand this approach. Then we also, on a subset, we did a whole genome sequencing and performed phylogenetic analysis. So as you can see from on the left panel, the overall prevalence from the baseline study was 67%, and the piglets experiencing diarrhea were shedding more of this pathogen. So in the cohort study, as you can see, even on day 1, piglets were already 40% shedding the pathogen. On day 7, it increased to 50%. By day 13, and this starts dropping down, and day 20 and 42, we don't have this infection. So probably that would suggest what they call colonization resistance from the piglets. So we performed a regression model using generalized estimating equations, which still also shows that the older the piglets, they are less likely to shed the pathogen, at least for this piggery. So in the environmental samples, most of the samples turned out positive, and that's kind of important. So C. difficile in this piggery, we thought meat was less likely to be a vehicle for transmission if the animals were properly harvested. So another important aspect is diarrhea in piglets affects the economic performance of the industry. So this should be taken into, is an important finding. So another important finding is anaerobic effluent ponds had viable spores, because I said earlier on that the manure is used by households and also commercial enterprises to grow gardens and also lawns. So that's important as a transmission pathway. So the next stage that we did, we followed the TEF and see, we examined the lawns. The scoring of old and newer loans were provided for by the TEF industry. So what was called new loans was something that was between 1 to 4 months. Anything older than that was considered old, according to their matrix for identifying. So we sampled 300 samples from 20 public spaces. Sorry for that. So these data were analyzed using mixed effects models. So in this, the most important outcome was new loans were twice likely to have C. difficile compared to the older loan, and that's pretty important. So amongst the ribotype, like I said, this strain, which is known to circulate in the hospital settings, is the one that was highest, accounting for 39%. So overall, from this study, the prevalence was very high and within the limits of what we have found in the livestock. But that's not surprising. Also, the results are not shown here. We checked for spore concentration. The younger lawn, the spore concentration was much higher than the old lawns. So this suggests of findings is that lawns at risk for pest, there could be a reservoir for community-associated infections. So the next stage that we did, we sampled from retail garden centers. These produce most of the mulches, and these mulches and garden mixes use manure from piglets or other livestock. So we just wanted to make sure that the composting that meets the Australian standard of production, we wanted to see whether it actually protects the public or something else should be done to prevent the infections coming out from these composts. So the overall prevalence was still high, over 22%, which still is within what our findings for in the livestock, and nearly 50% of that were toxigenic, implying that they could potentially cause disease if they infected anybody. So these are the ribotypes that we identified from the garden mixes products. So ribotype 014 is already, like I said, we found it in the lawns, but we also have in our previous studies have found these ribotypes that are labeled red. They've been isolated from humans, animals, food, and the environment. But we chose to take ribotype 056 to another level because we thought this was a ribotype that was becoming increasingly being isolated in the pest hospitals. So we performed the whole genome sequencing, and we used animal isolates, food isolates, and the environment to compare them to the human isolates to see how far apart, how closely, or how much genetic overlap they had by whole genome sequencing. So that is 29 isolates where we performed the whole genome sequencing. Then we got 3 clonal clusters separated by 2 single nucleotide polymorphism, and this I'll show you in the next slide. So these are the 3 clonal clusters that we identified. So the first clonal cluster is for 2 patients. This is separated by 2 years, and these 2 patients are coming in from 2 different hospitals. So we don't know how this infection could have been transmitted between these 2. So the second clonal cluster involves potatoes and a hospital-associated infection. This is 2012, and also community-associated infection, all of them from Western Australia. So we would suspect food as a source of transmission is possible. The third clonal cluster from this phylogenetic tree is on the bottom. We can see this is sheep, the isolate coming in from sheep manure, soil conditioner, and these are these are patients who are hospital-associated infection, and this one is community-associated infection. So we also have potatoes involved. So this is potentially suggesting that there's a likelihood of transmission going in from the food and the environment. Obviously, this is a small study, but kind of important. So our findings have demonstrated the close genetic overlap across many reservoirs. So the overall findings suggest that probably the national standards should be updated in Australia for composting. So among the 29 isolates, so 4 of the isolates were the ones that clustered from the cluster, the chronoclustering. So potentially showing 14% of potential infections coming in from the environment and food. So our study has been, the Williams and friends from the USA have just published a work similar to ours, and their potential transmission from the environment was somewhere around 19%, which is not far off from our findings, even if our study was small. So we had discussions with the industries to make sure that the final product does not have a high load of spores. That means probably having the laboratories to perform spore concentrations before they can use that type of product, or if other measures needs to be made. For policymakers, we suggested that probably this compost should be labeled like other labeled for potential contamination with C. difficile. So the overall findings from this work suggest that livestock could be an important reservoir for C. difficile infection. So it's also possible that the infection could also come from humans to animals, like I showed in the earlier figure of the transmission pathways, because it's quite complex. So a One Health approach is quite important way to address some of these complex infectious pathogens, because in this work we talk to many industries, that is the turf industry, the livestock, and also we involved the policymakers. So it means if every step, everybody involved in the pathway, production pathway, is involved in reducing and mitigating the transmission of the infection, probably it's likely that we can achieve a lower infection rates of C. difficile. But what we have shown so far in this study is we don't understand most of the other transmission pathways, and those needs to be investigated using high resolution tools and also better epidemiological studies. What is disappointing is our findings for C. difficile infection appears to be, obviously, we have just shown the tip of an iceberg, but not the overall whole picture, because this illness is not reportable. So most likely we are missing a lot of cases. So it's also another aspect is investigation of diarrhea in the community between the veterinarians and the doctors. Probably we don't do a good job. So future works, we suggest using high resolution tools for source attribution, and also using better epidemiological tools to understand the risks that are contributing to the infections between new and old suburbs, both in the lawns and gardens. Other studies should target the food chain, which will be trying to understand how much contamination exists in the meat works. And finally, also developing vaccines, probably that will be a better way to control this pathogen. So acknowledgement goes to the Australian government research training program and also the ARC for funding this work. I'm grateful to my supervisor and his team, and also Professor David Hampson, the other supervisor from Murdoch University, for supporting me through my PhD work. And the pork and teff industry in Perth are also acknowledged for helping to make sure that to make this work happen and reach its completion. And I'm also grateful for my family for supporting me through the PhD time. So that's it from me. Thank you.
Thank you, Peter, for your nice presentation. Is there anyone to ask a question? If there's any, I have one. So
Yep.
I don't know much about C. difficile, but how come one day old piglet shed the agent? I mean, what's the latent period of C. difficile?
Yeah, that's a good question. My understanding is obviously these piglets were not born. They are born overnight, and we have to take a sample in the morning. So I would imagine 12-hour time frame, which I wouldn't be surprised. But generally speaking, this is not the first study that has shown detection of C. difficile on day one. There are multiple of them. So I would assume.
So you're saying that they were infected as soon as they were born and they start to shed within 12 hours from the infection?
I think I would imagine within 12 hours, if they are born and they're on the ground where infection is, and obviously they're trying to suckle and they might have actually licked the ground. And also the udder for the pigs is obviously soiled in the pens where these animals are lying. So I would imagine if at the time they have suckled this milk, they have also potentially suckled the infection at the same time, because the udder is actually going to be dirty, and that's how my finding. It depends on the pig cleanliness, which as well, if you look at piggeries and piglets, I don't think you are going to find the cleanest environment.
Okay. Thank you. Oh, yeah.
There's a hand up.
Yeah. Hi, Peter. Nice presentation. This is Nagendra from ACDP in Geelong.
Thank you.
Mike, it's a good presentation. Just to follow up with John He's question, did you identify the organism in the feces or meconium or from the blood sample from the day-old piglets?
I think I would imagine, to be honest, because we swabbed the rectum using aseptic measures. So I would imagine everything could have been coming in from what colostrum they drank or what, yeah, pretty much. So meconium, yes, meconium. I know meconium has been actually in the babies that have just been born. Actually, C. difficile has been isolated from meconium.
So could that be a possibility that it was a transuterine infection rather than getting infected just within hours after birth, because the organism has to travel along the gut to reach those sites where you're finding it, because meconium is just something that comes out because of the bowel movement as the animal drinks its first colostrum that stimulates the bowel movements and then it comes out. So if the organism is in the meconium, that means it should have been infected prior to birth. That means it should be a transuterine infection, something like that. And did you observe the same organisms in the placenta, for example, so that you can relate something like that? I'm just asking this question.
No, that's a good question. It's absolutely a good question. To be honest, we didn't check the placenta, or because we technically we are limited with what we can do. It's a commercial outfit. So if our protocol suggested that we're going to rectally get the swab, and we couldn't do more than that. These were not experimental pigs. This is a commercial outfit. You can, we are limited to that. And also, our protocol couldn't go, but maybe for the future studies.
Yeah, I absolutely understand that. Thanks. Thanks, Peter. Good work.
Thank you. Thank you.
Thank you. Any other question? Okay, if not, then thank you, Peter, for your great presentation today, and thank you all people who joined our EpiCentre Seminar Series. So I'll let you know the next one soon, and until then, bye.
Thank you.
See you
Thank
guys.
you so much. Thank you.